Okay, we are live now.
Hey everyone, welcome back to another session. Today we have Dr. Jenny with us. She is an ortho resident and she'll be kind of sharing her experience about the residency. So thank you so much, Dr. Jenny, for doing this. And whenever you're ready, you can start.
Okay, awesome. Thank you so much for having me. I'll be going over what life of a UCLA orthodontic resident and residency is like. I'm the chief resident there, and I'll be graduating in about 3 months. All right, so I'll tell you a little bit about myself. I was born in South Korea, and I moved to Southern California when I was 8, and I went to Loma Linda and Irvine as well for high school. And then I moved to NYU to New York City for my 7-year dental program. And so it was a 3-year undergrad, 4-year dental program. And then I came back to Southern California for UCLA Orthodontics. And here's my handle if you want to connect with me. Why orthodontics? So my parents were also in the medical field and dental field. So my dad is a plastic surgeon and my mom is an orthodontist. And so I got a lot of guidance in terms of what I should do later in life. And I was very inclined towards sciences and math. And so I was able to kind of decide whether or not I wanted to go into any of those fields by kind of looking at my dad and my mom. I really liked how everyone was like, oh, wow, like, plastic surgeon. But my plastic surgeon dad told me not to go into like surgical fields because it is kind of a lifestyle that is hard, especially during residency. And for me, who I want to start a family, have kids, and things like that, I would be in residency during my peak time of life, which is basically like 26 to like 32. So I chose orthodontics as well because orthodontics offers you a really great lifestyle. And so I saw how my mom was, and I was like, oh, I want to be like my mom. She works, but she also takes care of the family. She also is able to like pick me up from school and things like that. And so I chose dentistry. My parents suggested an accelerated dental program, which would get me straight in. And so that's why I went that path. And actually, when I went into dental school, in the very beginning, I didn't want to go into orthodontics. And the reason why was that it seemed like everyone wanted to go into orthodontics. They wanted to be an orthodontist. So I was like, I want to be more special than that. But at the end of my second year, I whittled it down to 3 different specialties, and it was orthodontics, OMFS, and pediatric dentistry. And how I kind of determined why I wanted to do ortho was by observing faculty in each specialty. I was kind of looking forward ahead in my life, and like if there are people that have a certain inclination or tendency or personality, it may be because they are that way from the beginning, but it also may be because that their profession also makes them a certain way as well. So I looked at each of these professions and I saw that orthodontics, the faculty in orthodontics, they're beautiful, they're young. Even if their age was a little bit more advanced, they were still very young spirited, and they were very bubbly, very amicable. And so when I compared all of those things plus the lifestyle and the compensation, I was like, okay, it's so clear that I need to go into orthodontics. So what is orthodontics? So orthodontics is actually the diagnosis, treatment planning, and the treatment of malpositioned teeth, jaws, and occlusion. So basically, this is called a malocclusion whenever like teeth are crooked or the bite is off, like one jaw is ahead of the other, or the teeth might be misaligned on the upper and the lower jaw. And that's why people need to get braces or Invisalign. So here are some of the common problems that we treat. Here's an anterior crossbite where the lower tooth is kind of sticking out and it's always like hitting the upper tooth, whereas it should be tucked in the lower arch. Here you can see a posterior crossbite where the upper jaw is too narrow on the sides. And so you can see that it's sunken in like this on the side. And here is crowding. Basically, when the teeth are crooked, they don't have enough room to be straight. Here's an open bite, and this is when there's a space between your upper and lower teeth. And it's in the front, it's called an anterior open bite. If it's in the back, it's called a posterior open bite. But in these kinds of cases, patients can't bite into sandwiches or thin crust pizzas and things like that. So it does hinder your lifestyle as well. Here's protrusion, where the upper teeth are way too far ahead of the lower teeth. A lot of kids may have this, and this actually predisposes them to getting trauma in the upper teeth, because they're so far out and the lips are not protecting the teeth. And so if they fall and they hit their head, those teeth are kind of the first to go. So correcting that early on may be a beneficial endeavor. And here is ectopic eruption. This tooth should be erupting behind this tooth, but it's erupting kind of into it. And so it's kind of hindering that kind of eruption. Here you see an underbite. We call that a class 3 occlusion. And this could be immediately treated or later treated in life. And here's a diastema, where there's a gap between the tooth. And then oral habits like thumb sucking, finger sucking, tongue thrusting, all of these can lead to open bites like these, because a physical object is in between the upper and lower teeth, and the teeth will kind of lend itself to that physical object there, which is why an open bite develops like this. And that's why kids, when they have pacifiers for too long, they will also develop an open bite like this. So here are just 3 general occlusion, malocclusions that we treat. Here, it's basically broken down into just upper jaw and lower jaw. And so here we've depicted it in terms of puzzles. So when the upper jaw and the lower jaw gear well together and they're in harmonious positions, it's called a class 1. But when the upper jaw or the lower jaw are discrepant and the upper jaw is more ahead relative to the lower jaw, it's called a class 2. And you can see that in a lot of people who have very retrusive chins. Their chins are very small and very backward. Here is a class 3 where they have an underbite, where the jaw looks very obviously forward. Here would be a surgical case if it was that severe, but it could be a little bit milder than that, where just the teeth are a little bit class 3. So this is one term that you should know. Malocclusion is mal is bad, right? And occlusion is the bite. So we treat malocclusion. And why do malocclusions occur? It's a combination of bone, teeth, and soft tissue forces. There's always forces going into the teeth as well as going out of the teeth. And so all of our facial muscles and tissues, as well as your tongue, are always constantly pushing on those teeth. And so depending on that, as well as the amount of bone that is there in the jaw, you can get crooked teeth, you can get that posterior crossbite, as we talked about, as well as anterior open bite if the tongue is thrusting forward constantly throughout the day. So here we can see genetics also plays a role. If they have too large teeth, too small teeth, if they have too small teeth, it may cause spacing, where there's space around all the teeth. And also if they have too many teeth, where they have an abnormal number of teeth or a lower number of teeth, that could also lead to malocclusions as well. And also if the jaws are too small or too big, then it can lead to malocclusions as well. Habits, we've gone through that, finger sucking, early loss of teeth. So when kids don't take care of their teeth and they need to get extractions done, what happens is the teeth drift into the space. And so that may actually end up trapping one of the adult teeth inside of the bone, because basically 2 teeth are converging like this, and there's no room for the permanent teeth to erupt. Also, craniofacial anomalies. I'm sure you've seen cleft lip and palate, where there's a little cleft in the lip as well as in the bone, in the alveolar bone on the bone here. So here you can actually see a bilateral cleft patient. And you can see that this canine doesn't have enough bone to erupt correctly. And this segment here is actually completely detached because there's a cleft here and a cleft here. All right, so what is a typical day in orthodontics residency like? I'll show you a typical day. Oh, sorry, you guys can't see that, huh? Okay.
Hey guys, my name is Jeon, and I'm a third-year orthodontic resident at UCLA. I've been getting a lot of questions as to what a day in the life looks like for an orthodontic resident, so here is a day.
Oh, sorry.
I am logging in for my Orthodontics seminar for Sunny.
Hey, you're looking at the bright lights? Is that what's happening there? There you go. Okay.
Today we have a lecture by Dr. Ozaki, who's an oral surgeon and a plastic surgeon. He is our craniofacial plastic surgeon that we work with to treat our patients.
Basically what I do, frontal craniotomy, and then I move the whole frontal bar.
Orthodontists are essential in treating patients with craniofacial anomalies. Our main job is to expand the upper jawbone and align the teeth for the patient's jaw surgery. Just finished the lecture. Look at that golden hour light. I'll typically have a super duper Korean breakfast. Clinic usually starts at 9 a.m., but due to COVID, we only have half-day clinics. We have case reports due soon, which are presentations of our patient treatment progress.
Nowadays, I'm in clinic by 9.
Research meeting today at 5:30. We need to get some things done because I tend to do two things at once. I love using like a whiteboard to write down all my tasks. I write down the things that I need to do and tackle them one by one. There's a lot of stuff to do, but I will get it done. Are going to school. I bike to school.
I walk to school now.
Here are all the residents and the faculty. We are here with the great Diana Malocclusions. So we're going to put some PPE on. Here is Joseph, our first year chief resident. 7:05, and we are working on our x-ray tracings for our case reports. So we can see all the tooth movements that have happened between. So we're gonna look at this condyle. Probably higher.
Stop filming me.
It is now 11:15. We are still here. This was our lives in first year. Literally every day, 11 or 12, we'd be working on our. Look, oh my.
So what?
Okay, we're going home. Going home. Wow, I've gotten so much better at biking. I can actually film myself. You know, bird is actually pretty hard the first time. Yeah, and then you have to go to the hospital. Remember? Yeah. Look at me now. Wait, what? Look at me now. Look at you now. Look at me. Look at you now. Look at me. Hi to the camera. Bye. It's kind of nice to be out here when no one is out here. Alright, I am back home now, back at midnight. I am going to take a shower. Wow. Tomorrow I have more work to do. My desk is kind of a mess with all of these models that I need to work on. This is all a learning experience, soaking in everything that I need to during residency so that when I go out to practice, I will be able to do all of the things that I learned. It's at least kind of an incentive. Anyway, I am gonna go and see you guys later. Oops. Okay. Let me get back to sharing my screen. All right. All right. So that was my typical day. So that was actually a typical day during COVID lockdown. So that was actually filmed in about July. And now we actually have about 80% of the clinic open. So I usually go to clinic by 9. We'll do all of the seminars through Zoom. And so we have a case presentation from 8 to 9, and then lunch, and then case presentation from 1 to 2, and then 5:30 to 7:30. Sometimes we have master's degree courses or a case presentation preparation, kind of like what we were doing. So how many patients do orthodontists or orthodontic residency? Actually, so right now in residency, we're seeing about 4 to 10 patients, and we don't have any assistants, so we're doing everything by ourselves. So this includes wire changing, retainer checking, or in a 60-minute time, we can wire change, rebond some brackets, do some photos, insert some appliances, and things like that. In about 2 hours, we can do a complete bonding of brackets on upper and lower teeth. But in private practice, it's a lot faster. So a typical orthodontist who has multiple assistants, usually there will be about 3 or 4, or in a very busy practice like this, they can almost sometimes have one assistant per chair. So in this practice, for example, you would be running 6 chairs at a time, seeing 6 patients at once. So usually the orthodontist tells the assistant what needs to be done next, and then the assistant does the job. And they usually see about 30 to 150 patients a day, and the average is about 60. And there's 2 to 7 assistants, and you can see multiple patients at once because now you have cloned yourself with these assistants. So what kind of procedures do orthodontists perform? There's non-surgical orthodontics where we can use braces, we can use clear aligners, or we can also use appliances like this expander here.
And some types of non-surgical orthodontics that we do is phase 1 and phase 2, and this is actually for kids who have severe problems that need to be treated in the very big, more earlier on, where we do all of the corrections that are needed in phase 1, and then we wait until all of the adult teeth have erupted, and then we go into phase 2 where we restart the treatment again, and then we set the bite and the teeth into a perfect occlusion. Or some of you guys may have just had one round of orthodontics, usually during your teenage years, and that is just a comprehensive treatment where teeth are all into place, and so we either take out teeth, we expand, we can do other things, or set you up for jaw surgery as well. And so the next type of orthodontic treatment that we do is surgical orthodontics. And this is actually to treat severe skeletal discrepancies. And so I'll just go through these examples here. And so here we see a typical class 2 where the lower jaw is a little bit too far back and the upper jaw may be a little bit too far forward. So what we do is we set up the teeth to do a jaw surgery to advance the lower jaw forward. In this case, she's actually a class 3 where the lower jaw is protruding too much. And so what we do is we set the teeth up for surgery, and then we do a mandibular set back, which means the lower jaw will go back during the surgery. And the upper jaw actually may come forward a little bit during the surgery as well. And these are just variations of the same thing. And here we can see a gummy smile where the person is showing way too much gum when she smiles. In this case, what we do is we set her up for surgery with braces or Invisalign, and we refer them to the oral surgeon who will actually impact the maxilla, which means basically cut the upper jaw and then move it upward. And then after that, she won't have a gummy smile after that. And so what happens is when we wait until the growth is complete, and we do that because sometimes we may do the surgery. If it's too early on, we may do the surgery and then the patient may grow in the lower jaw more. And so the surgical movements have been negated. And so in those cases, because of that, we wait until the patient is done growing. And so here is kind of the pre and post orthognathic surgery tooth movement. So the patient pretty much comes to us like this, where actually the lower jaw is a little bit ahead of the upper jaw. And so what we do is we make the teeth set into the right positions within each jaw. So actually, teeth like to touch each other and meet each other. And so in this case, even though the jaw is in not a good position, the teeth are trying to meet each other. And so with the braces or Invisalign, we basically put the teeth where they should be, independent of each other, because we'll move this whole piece forward, this whole piece back. And so with surgery, we move the upper jaw forward and the lower jaw back in terms of a class 3 surgical orthodontic treatment. And so what are some innovations in orthodontics? We can use temporary anchorage devices or mini implants. And these kind of just serve as anchors for us to pull teeth backward and to move teeth backward. And why this is useful is because, let's say in this example here, these teeth are in really good harmonious bite in this area. But in order for us to bring these teeth back, we need an anchor. And if we use these teeth in the back here, what happens is these teeth tend to move forward as well, disrupting this harmonious bite that's present in this area. And so if we use a bone anchor, we'll be able to have this stationary as we are pulling this segment back into class 1 canine and class 1 molar occlusion. Actually, in this case, it's a class 2 molar, but I guess that's how they are compensating this case. And we also can use clear aligners. Clear aligners have been kind of the innovation in orthodontics because we can take digital scans and send them out to Invisalign, where we do a lot of the movements virtually, and then the aligner company sends us back trays that have programmed movements of 0.25 millimeters or even less or more sometimes, and the patient will wear those trays about 1 week to 10 days, and it'll gradually move the teeth over time. We also have 3D x-rays, where we can take a three-dimensional x-ray of the head and the jaw area, and this will help us see where the teeth are. So in this case, she actually has a cleft. She's a cleft lip and palate patient, and you can see that the bone is missing in this area here. And so in these kinds of cases, it's imperative that we take these kinds of 3D x-rays so that we see exactly, okay, this canine is coming down here, this cleft is here, what should we do about this cleft? Okay, let's do a bone graft, things like that. Digital scanning, we covered. So you might have seen some clear aligner companies that are advertised, and these are actually called direct-to-consumer companies. And orthodontists don't endorse these. There are pros and cons about these direct-to-consumer companies. One of the pros being that it reduces the cost for orthodontics to the patient and it increases the access. However, there are a lot of cons because there isn't an actual orthodontist or a dentist actively monitoring the treatment, and also they don't require x-rays as well, and so it kind of bypasses the proper radiographical diagnosis and the doctor. And so there may be undiagnosed problems such as cavities or bone loss or skeletal discrepancies. And so you may actually end up losing some of the teeth if these teeth are compromised and they are moved. Also, a lot of people end up getting a bite that is misaligned because a lot of people think that, okay, we can just straighten out the teeth. If you have straight teeth, it looks great. In reality, your teeth can be straight, but the bite is also what matters as well, because if you just straighten the upper teeth and straighten the lower teeth and the bite doesn't gear together, you may not be able to chew food very easily because it's only hitting in certain areas. And so that is actually a very common problem, and they come to us to fix their bite. Also, the teeth supporting gums and bone may be compromised, and so if you actually move teeth while the gums and the bone are in bad health, then the teeth actually may lose more bone and more anchorage, and so it may become more mobile and end up falling out in worst cases. And it also may be an increased cost to the patient in the long term, because in order to fix the problems that these aligners created, you have to go to another orthodontist or a specialist to fix that. And so how did I get into orthodontics? So this was actually put together because of pre-dental talks and things like that, which I'm sure you guys are all pre-dental mostly. And so in high school, I took AP classes. I took science, pretty much all the science classes, the math classes, and I did extracurriculars like clubs. I did choir, orchestra. I don't know why now I don't do any of those anymore. Maybe I sing a little bit, but and I guess I still play violin. And then I also just tried to get my academics as high as possible. And a lot of my friends were really smart, so that always helped me. And in pre-dental, I was in the 7-year dental program. And so we were required to upkeep a minimum GPA of 3.5 or higher. But again, my friends were really smart. And so I was pretty motivated to do well in school, and so I definitely was above 3.5. And then for DAT, we actually just had to get above the national average because we were in the accelerated dental program, and so I believe at that time the national average was 19. And so I was like, okay, let me study. and then I'll take it. And then if I don't get it, then I'll retake it. And so I studied for about maybe 4 months during the summer break, and I got an overall score of 23, and I didn't really stress about it, and so I just submitted that score. And the good thing about an accelerated dental program, if you guys are still in high school, anyone in the audience, is that you don't have to like exert so much energy in getting like the highest of everything, because you've gotten yourself already into a track. And so if you are interested in going into dental school starting from high school, this is a great option for you. In college, I also upkept my extracurriculars. I did some research with the chemistry department on crystals and proteins, and how to preserve vaccines in crystals, which is like, I guess, more pertinent now than ever. So that was interesting. I ended up publishing that paper while I was in dental school. And I did some club leadership. I was a part of the Christian club, and I was the worship leader. And I did some outreach and shadowing as well. And in dental school, I definitely kept up my grades. So to be an orthodontist, it's a super marathon of a journey. It's not just, okay, let me get into dental school. You can't burn out too easily. And actually, the biggest challenge is in dental school. So definitely don't burn out during college or high school. You will get into dental school if you're persistent enough. So just save a little bit of your energy. Of course, do your best at all times, but just know that dental school is going to be tough. And so just, ready yourself for that. So I definitely kept up my grades, and leadership. I did clubs, class council, and that actually really helps you to get plugged into the school. And I did community outreach for actually peds, and that's kind of why I was also interested in pediatric dentistry. I did research. I got some scholarships through the sites where I would submit my ideas, and it's called mindsumo.com if you guys are interested in kind of flowering up your resume, and if you guys are prone to writing and coming up with new ideas. Also, this is the biggest tip that I want to give you guys. If you guys are in dental school and you guys want to go into an orthodontic residency, externships are so crucial. A lot of people don't do them, but this is how you can get your name out there and your face more familiarized with the people that will admit you. And so I've done an externship twice to UCLA Orthodontics when I was in dental school. And so I think that was very key in me getting into my top choice, which was here, because they already knew me. They, if you're amicable, you're likable, and as well as you have the grades and the leadership, the research, as well as other scholarships and things like that, then it's a win. So definitely go do some externships. I know it's hard with COVID, but in the future, if there are opportunities, definitely go for it. Also, what advice do I have for pre-dental students? Number one, keep your friends and family close, friends and your community. You are the average of your 5 closest friends. So if you don't admire your friends, maybe expand your circle, because for me, I've always been around people who are really smart and oftentimes smarter than me. And so it would raise me up to a better standard. And because I wanted to do well, I would seek their advice, and they would also seek my help as well, and kind of it'll be a synergistic relationship, as well as hang out together, have fun together. And also, a lot of people think that friends, or maybe people may feel that friends could be competition because you guys are striving toward the same thing, where you guys all want to go to dental school and things like that. But actually, friends are not your competition. Your competition is out there. People that you may not know in other colleges that are also applying to dental school. And so I would advise you guys to work together. never just kind of botch someone because you want to get into a better college. If anything, this community is very small. And so if you burn bridges even earlier on like this, you guys will may run into other problems later on. Also, use your upperclassmen resources. Upperclassmen have already taken your prerequisites, the things that you have to do well in, and so ask them for test questions like, what was on the test? What do you recommend me look at? Things like that, and they will really advise you. And I am pretty sure probably 80% or more upperclassmen will be so willing to help you. Also, another pro tip is only go to upperclassmen who are the top of the class. Because if you ask upperclassmen that have not done well, number one, they might be hesitant for them to help you so that they can do better than they did. So get the tip-top best upperclassmen, ask them for advice. They will be so willing to give it to you because they've already achieved it at the top. So it doesn't really matter if you do as well or the better, because there is no better, because they've already achieved the best. So definitely use those. Get to know your professors personally as well. Have your Zoom camera on during your lectures, because when you're talking to people on Zoom, it may be very impersonal, and it may not feel like anyone's listening. But if they see that your face is always on and they see your name associated with your face, they'll be able to know you better and you'll get a more personal recommendation letter as a result. Also, do things that you're interested in, not things that you want to do just to flower up your resume, because in the end, you will have enough things to put on your resume if you pursue the things that you are interested in. And if you do things that you're not interested in and you end up putting that on your resume, and then you go to the interview, your interviewer will kind of be able to tell whether or not you're passionate about this or not, or if you're knowledgeable about it. And you will most likely be knowledgeable and passionate about it if it's something that is interesting to you. And so that's definitely one thing that interviewers want to see. They want to see passion, they want to see interest. And so definitely pursue things that you want to do, even if it's not related to dentistry. If it's cooking, that's fine. And a lot of people ask me, what kind of research do I have to do? You can do any research you want. It doesn't even have to be in science. It can be like social sciences if you want. It can be like math. Honestly, the fact that you did research is what matters, because research is actually the advancement of knowledge, and that's what they want to see. That's kind of how we become better in science and in medicine and dentistry, and that's the quality that they're seeking. Also, some recommended reading are these 3 books, and during the time that I was struggling through college and dental school, I say struggling because I always stress myself out to do better and better. And these books really helped me. And always just seek ways to do better, because you can always do things smarter and more efficiently. And so these books really helped me see how I can memorize faster, which is this book, and how I can make myself a better candidate and better applicant to dental school by reading this book as well as this book. And also, don't burn out. The real studying is in dental school and residency. You're not going to be a biologist, right? You're not going to be a chemist. So yes, do well on these courses, but definitely the real studying is in dental school. So what did my pre-dental CV look like? I'll show you guys my pre-dental CV, if I can get out of this. Okay. So definitely, I think I could have done my CV better in hindsight. I could have definitely had better graphics, more color, a headshot, and things like that. But yeah, so here was my resume. I just put my GPA. high school
Thank you.
leadership.
I don't think we can see
Oh, sorry.
the resume. It's okay. There you go.
So yeah. So my name, I should have put in a headshot, made more graphic design choices. So here I just put my college, my high school, just some leadership activities, skills, language, computer skills, research, and professional experience. This was actually shadowing different clinics, and then community service projects like mission trips that I've been to as well. So what I would have done differently now is I would have included everything that I did, because I actually left some things out because I was like, maybe it's not relevant and it's not important and it may actually hurt me. And some of the things that I thought would do that was Christian club worship leader. I was like, I don't know, religion is a little bit controversial, but honestly I should have put that in. Anything that you are a leader in, I think, is very favorably looked upon, so definitely put that in. Also, I thought that my resume was getting too long, so I left out some of the research that I did, which was with Dr. Bart Carr, with the crystals and the vaccines, but I definitely should put that in. It doesn't really matter. A lot of people say, okay, your resume should be 2 pages or no more. It's called a CVs. Curriculum vitae can be pages and pages long. So make it as long as you possibly can. Impress the heck out of those interviewers, and that will definitely get you into a good program. Also, some mission trips that I did. Also, definitely have a better graphic design than I did. My residency resume was way better looking than this. So use canva.com, use a professional headshot, and definitely that will help you guys in the long run. Actually, if I can pull up my, I don't know if I have my, okay, I actually don't know if I have my residency CV, but let's go on to case presentations. All right, so this is a patient who presented to us. He was about 14. He had bombed out molars. Bombed out basically is kind of slang for just cavitated. There's just basically the patient had cavities there. He did get it restored, but it was so big that the fillings would chip off. And so also, if you look at his incisors, they're very much far ahead, and so that's contributing to the lip posture here. He does have very thick lips though, so you'll see later on that this doesn't change too much, but he is able to close a little bit more. So when the teeth are a little bit too far out and the lips can't fully close, the patient may develop something called a Mentalis Strain, where the muscle on the lower chin and on the chin kind of contracts to close the mouth. And here we can see, this is his panoramic x-ray, where we can see that these teeth have been already treated, and he's only 14 years old. Here we can see that there are adult teeth that are trying to come in, but there's no space, because probably these baby teeth were lost too early, and these molars have moved in, caved in, and so there's no room for these teeth to come in. Also, so here are just some more x-rays. So what we ended up doing was we extracted the first molars, and then we started closing the space where the molars used to be. And now here is where the adult tooth that is trapped, what we call impacted, are. And so we're just keeping that space, actually closing it a little bit because the space is a little bit too big. Here you can see that the adult teeth have come in now, and here the spaces have closed completely. So this looks like the first molar, whereas this is actually the second molar. So here you can see that these teeth that were jutting out like that are now nicely tucked in like this, and the compromised teeth that were decayed and probably would need to be extracted later in life anyway were extracted, and we closed the space up like this. So now we've closed up pretty much all of the space, but there is a little bit of a discrepancy. So here we can see that it for the most part gears well together, but the upper teeth need to go in between these teeth, so we need to have him wear some rubber bands in order to fit those teeth properly. Case number 2. So case number 2 is a surgical class 3 case, and she presented to us at age about 17, and this was the perfect time to start the braces. And as you can see, the lower jaw is way too far ahead of the upper jaw, and so it's a little bit too far of a discrepancy for us to treat with just braces alone. And so what we basically have to do is we need to plan out the surgery. We need to plan out the surgery using virtual planning techniques, which I will show you now. Can you guys see this?
Yeah.
I'll reduce the volume on here. So we can see a class 3 skeletal pattern. Here the lower jaw is way too far out. And the maxilla is also too far back as well. The lower jaw has about 8 millimeters of crowding, and the upper jaw has 14. So what we do is we trace that x-ray from the side, and then we match it to the photo on the side. And then now we start moving the teeth as if we've extracted one tooth on the upper, or 2 teeth on the upper, and we've also taken back the entire upper arch backward. We're also planning on some intrusion of the lower teeth and a slight extrusion of the molar here. And then we do the orthognathic surgery by moving the jaw up and back for the lower. We also can do a little bit of rotation like this to correct any improper bites. So here we're just doing some more adjustments. And here the lip looks a little bit short, but that's because of just the Photoshop functions of this software. So here we can see what dental movements we did before the surgery, and then this was kind of simulating the surgery and seeing how it would be different before and after. Okay. All right, so that concludes my presentation. I will take any questions at this time.
Awesome. Thank you so much. That was absolutely wonderful. We do have some questions from our Instagram, and we have like 10 or so minutes, so I think we can fill up that time. So one of the things that I found really interesting was the 7-year program that you talked about. So what made you choose that, or how did you kind of get ready to apply for that? Because I actually personally have never heard.
Okay. So yeah, these 7-year programs, there's actually even shorter programs at UOP. UOP actually has a 5-year, 6-year, and a 7-year program, and that basically dwindles down the amount of college years that you need to do in order to get into dental school. And it's usually the same school, but NYU also has one where you go to Adelphi first, and then you come to NYU for dental school. This is basically just tailored for people who already know what they want to do dentistry. Yeah. And so for me, I did 3 years of undergrad and then 4 years of dental school. So I just shaved off the senior year of my college days, and then it saves you some tuition and time.
Awesome, thank you. So is it possible to work as a general dentist while specializing or being in residency?
Some people do that. It's called moonlighting, where you go into residency and then you work on the weekends. Personally, for our program, we are paid, unlike other orthodontic residencies. So usually residencies in dentistry, you have to pay a tuition, because in dentistry, you don't need to specialize in order to practice. You can practice straight out of dental school, whereas in medicine, you do have to do a residency in order to practice as a doctor. So because it is kind of an elective program to take, there is a lot of tuition that is involved, and it can range from anywhere from $20,000 to $100,000 a year. And so it is a hefty cost, but people do it because it is worth the money. That's what they want to do, and they actually do end up making about 2 to even like 5 times more than a general dentist. So yeah, I have some friends who are moonlighting on the weekends, but it is some sacrifice that you have to make on the weekends.
Awesome, thank you. So was it hard or like confusing when like applying to dental school and then also residency, and did you get help along the way, especially people that might not know what exactly to do?
Of course. So right now I'm an orthodontic resident. I'm a third-year orthodontic chief resident. So yeah, I actually had the same questions too, but I think you can't really know what a dental school is like. You can't really know what a residency is like either. So a lot of people end up just kind of applying because they think the college and the dental school would kind of have a similar reputation, but it's not always the case. Just because a college is ranked high doesn't mean that the dental school is also equally as good. And this is because in some areas, there may not be as many patients, or that school may not be research oriented, which you might want to be pursuing. So it's really dependent upon what you want to pursue. If you want to teach, then you would want to go to more of a research oriented school, whereas if you want to be a clinician and you want to practice in private practices and you want to be treating patients, you want to go to a clinically focused school. And so the best way to do this is to reach out to alumni, people who have already gone to those schools, or dental school students who are at that school, preferably fourth years, because they've already kind of gone through the whole spectrum of that program. And also for residency, I would definitely reach out to people who have already gone through that path, or ask specialists. Like for me, my mom was an orthodontist, and so I asked her, hey, like, what are some of the programs that you know, or what are some of the programs that are famous in dentistry in orthodontics? And UCLA was honestly one of the most world-class orthodontic residencies, and so that's why I came here. I wanted to learn from the best, and also UCLA is paid as well, and so that was a major attraction for me. So just the overarching theme is to seek advice from people who have gone further ahead of you, and just seek their opinion.
Right now. Awesome, thank you. So the next question is catered towards research. So even for me, like, it's really difficult to find research on campus. So what are your tips to kind of reaching out to professor? How did you go about it with your crystal research?
Yeah. I think even without COVID, it's hard to get a project because, someone's not going to just give you their baby, right? You have to show your interest. And so what I did was, at least at NYU, and I'm sure there are these websites for other schools as well, but if you search your university and research, you'll get a list of faculty who are doing research and what their topics on research are. And so pick from that list about 5 to 10 people, and reach out to them, email them, and it may not take the first time. So you may have to email them 2-3 times. For example, the research that I did with the crystals and the vaccines, I have to email them about 3 times before they reached out to me. And so if they are looking for help, they want people that are, dedicated, that are really interested. So you can show your interest like that. If it is too difficult to find, another way is to see if you have any friends who are already in research, because that's kind of how I got my research during dental school. I had a friend who was in a research lab, and she said, hey, like there's an opening available, and because your friend is referring you to that professor or that PI, that professor is more likely to trust that you are a dedicated person. And so those kinds of referrals are very useful as well. But let's say there's no research going on because of the lockdown and things like that, then just look for other extracurricular activities that you can do. There's scholarship opportunities at mindsumo.com when I was applying, and so anything like that to make your resume shine a little bit more, or like learn a new skill on udemy.com, maybe like computer programming or something, anything like that. They will understand if you don't have research, and I think nowadays it would be a little bit more condoned without research to get into these kinds of programs.
Awesome. Thank you so much. So our next question is just, when coming into dental school, especially since you did have an accelerated program, what was probably like the biggest learning curve, going from like just typical undergrad classes to now dental school?
I think that learning curve is there for everyone. It's a huge shock when you go into dental school, because the amount of knowledge, the amount of material that you went over in a typical college class, you went over like a whole semester's worth in 1 week in dental school, and you just have lectures after lectures after lectures after lectures, and you're just bombarded with things that is new to you. It's almost like as if you're learning a new language, because you have to learn the terminology of what dentistry is, because you have to now speak in dentistry. And so those kinds of things, it's a little bit of a shock. And whenever you're learning new things, it's a little bit stressful. A little bit is an understatement. But because you're trying to learn a new language and all of these new concepts, you will be overwhelmed. But the biggest thing that is important during this time is to have really good community and really good friends around you who are as motivated around as you to do well as time management and just persistence. A lot of people actually get discouraged very, very early on in dental school. So they start out saying, hey, I want to be an orthodontist, I want to be an oral surgeon. And then they see their grades come back and they're like, oh, I don't think I can be an oral surgeon. I don't think I can be an orthodontist. I don't think I can be this and that. But one exam score is just a drop in the ocean. So do not be discouraged. Keep trying. And even at the end, even if your GPA is not high enough, you may still get into a competitive specialty. It may not be the most competitive program, but you will still be an orthodontist at the end of the day. And so through all of this and get really good recommendation letters, and it's a multifactorial game. And so definitely try your best in all things, but persistence is key.
Awesome, thank you. So we have like time for one more question, and it's just kind of comparing residency with dental school. Like, do you think one was harder, or they're both hard in their own manner, or like a little insight on that?
Okay, yeah, of course. So for me personally, I think dental school was harder because you're learning a new language. It's so much information at you at the same time that you're trying to just absorb everything. On top of that, you're trying to do well because you want to get into a higher level of education after, and you want to get into a better residency. It's kind of where you guys are at now. Like, you guys want the best GPA, the best DAT score in order to get to a program. So in dental school, I was a little bit stressed out about that, and I think that's kind of why it was harder. In residency, I think it was definitely hard, but there's no pressure of like, oh, I need to get into another program after this. So it's a little bit mentally not as stressful, but of course, orthodontics is kind of like the ugly duckling of dentistry, because you don't really learn that much about orthodontics in dental school, sorry. And so when you come into residency in orthodontics, you're like, oh my gosh, this is a whole new world. This is like dentistry like I've never seen it before. And so in that manner, I was learning another language after that. And so that was a little bit of a learning curve, but definitely after my second year, I became a lot more confident, and now I am pretty ready to become a full-fledged orthodontist.
Awesome. Thank you so much. So that's all the questions we had for today, and it's 9:30 now. So thank you so much, Dr. Jeon, for coming to our YouTube channel. We really appreciate it, and the presentation was absolutely amazing. Thank you so much.
Thank you so much.